At Boulder Heart, our number one priority is patient outcomes. And when we're dealing with AFib, that looks like best quality of life and the fewest number of symptom days possible that we can achieve. And so with this in mind, we sought to develop our AFib clinic to address some of the challenges that we see in our current healthcare system that can sometimes result in fragmented care and in delays in care and in patients not having the ability to access the resources and the types of information that they need to achieve those best outcomes. So we modeled our AFib clinic after guidelines that were proposed by the American College of Cardiology and the Heart Rhythm Society. This model has been really demonstrated to improve these patient outcomes by making sure that patients receive the highest level of care while attending to their multiple comorbid conditions, the risk factors that Dr. Oza mentioned, and receive and are connected to the types of treatments that are innovative and that can help address their symptoms, like ablation, the Watchman device, surgical intervention, so that they really can live their best quality of life. So what we did is we pulled together a number of resources to connect patients to the robust set of AFib resources at Boulder Community, and the way that we modeled that is our AFib clinic. So patients are connected with me or one of my counterparts initially, and we spend a lot of time evaluating you from head to toe, talking about some of the lifestyle considerations that Dr. Oza mentioned, talking about your overall health. We know more and more, and research has shown that AFib is often a symptom of something else going on either in the body or in your environment, a stressor that can trigger AFib. So if we just focus on treating the rhythm itself, we're missing an opportunity to achieve those fewest number of symptom days possible. We're missing a big part of the picture there. So our AFib clinic is really geared towards that whole person approach that we think our community deserves. And we focus on a multidisciplinary approach. So we pull together a number of our specialists, our neurologists, our surgeons, our pulmonologists, our folks in the emergency department, our hospital medicine team, our primary care providers. And we spend a lot of time both collaborating about our complex patients, connecting those patients to the right resources, some of which we've heard about tonight, and also making sure that all of the providers in our system have an education surrounding the most up-to-date guidelines for managing AFib, making sure that folks know how to connect patients to the AFib clinic in a really timely manner, and making sure that we reduce potential complications associated with AFib, such as stroke. So that full spectrum of care is available at Boulder Community, and we needed a way to tie all of that together. And we did that by developing our AFib clinic. So our ultimate goals came down to the fewer number of ER visits for patients as we can achieve, aggressive risk prevention, streamlined access to care that I mentioned. We really strive to see our AFib patients with a new diagnosis in a really timely manner so that they can get the information they need as soon as possible, and so that we can minimize some of those other risks that we've talked about tonight. Ultimately, this model also results in a lower cost of care for patients and their families because it's more efficient, it's streamlined, and it connects patients where they need to be when they need to be there. So the number one goal of this clinic is supportive care. It's a one-stop shop to be able to find the resources that you need to take care of yourself and have the best quality of life and the best outcomes living with AFib. These are some of the specialties that we work with closely in our AFib clinic and that we tie together through regular meetings, ongoing connections, and the facilitation of our multidisciplinary care here. So we're really excited about this program. It allows us to serve our community in the best way possible. The number is super easy to remember, 303-443-AFib. Our email is afib@bch.org, and we're available to answer questions about how best to take the next steps in your care or your family's care moving forward with AFib.